For those folks trickling in, we will start at 3 minutes after the top of the hour. And if you want to put in where you hail from, feel free to do so. And Susan set a good precedent, both like professionally and geographically. All right, it is 4:03, and given that we do try and start on time because there's a fair bit of content to cover in our hour and a half, I will start. So again, for those of you who did not see my intro in the chat or hear my intro at the top of the hour, I'm Sarah DeSilvia. I have the honor of being the Director of Terminology. Welcome to the Gravity Terminology Workstream Community Call. As part of our open consensus process, we make sure that we bring things to the public. And for those of you, many of you have been here for some time. It's 6 years now we've been doing this. And we're going to be covering further concepts in food access, neighborhood safety, and access to green space. Next slide. Thanks for coming. As you know, and I hope you don't have too much background noise. I am on my screen porch. So everyone's muted upon entry, but there's open conversation throughout the meeting. The calls are recorded always, and the recordings are available on the Gravity Confluence. There's a, recorded index of all the conversations we've had here over the course of our 6 years in time. Everyone's encouraged to participate in the meeting. You can put any questions you have in the chat and just send it to everybody so that we can all read the question, and then we can ensure that we respond accordingly. Next slide. So this is a slide, we just updated it today because I'm giving a presentation on what it means to be develop standards and consensus a little bit later in September, just a little bit later this month. And one of the things that we just note is we follow Gravity. Gravity is required to follow antitrust practices, and that's partly because of our role as an ANSI accredited standards entity through our HL7 affiliation as an HL7 accelerator. So that's just part of the nature of being ANSI accredited. And so we all have to, everyone participating in our meetings has the responsibility to comply fully with federal and state antitrust laws. Anyone speaking or providing communications has to refrain from antitrust violations. And we do apply this very generally. Again, rarely is anything said in this meeting that triggers this, because this is not the nature of the meetings that we have here in terminology. But we still make sure that we state this out loud. And so just know we discourage direct violations of antitrust policies, but also avoiding anything that might be construed in an antitrust violation. We decided for fun this time to link the ANSI accreditations at the base. It's always good for terminologists, so we always try to figure out, and scientists, so the sources of things matter. Next slide. So our agenda today is welcome and announcements, very brief. Fall 2025 topics and goals, again, brief because we've done a lot of introing to date. And they're going to be going through the three different domains with Asha and I trading off. First discussing neighborhood safety, then discussing our food access concepts, and then discussing access to green space concepts. And then we're going to give some cross-domain updates, and I'll pass the mic to our dear colleague, Susan Matney, a senior terminologist, to talk about some updates to LOINC document types, and then we'll close with homework, always. Next slide. All right, next slide. Welcome and announcements. This is this trim list of announcements. So we do invite everybody to the Gravity Technical Implementation Call, which is our sister call. It happens Wednesdays from 1 to 2 Eastern Standard Time. It was just, and there was a nice overview there. We also ensure everyone's invited to the implementation work stream, which is the combined forces of terminology and tech. We just had a meeting on August 28th. That recording is available on the Confluence. It focused on the New York waiver implementation and how it's leveraging Gravity terminology and technical standards. Our next meeting is November 20th. These are happening quarterly. This is a small list of upcoming webinars and presentations because the truth is even I myself am flying across the country and going to 4 or 5 different conferences within 4 weeks. So these that will be very intentionally at the working group meeting in Pittsburgh. We hope to see folks there. It's always good to see the HL7 community. We are going to be at our Partners in Implementation, the Civitas Annual Conference. We have one direct presentation there, the Gravity submitted with members, but there's a couple other Gravity mentioning and Gravity adjacent presentations, including one again by our friends in New York. So looking forward to seeing friends and lots of the Gravity community at the Civitas conference. Next slide. Any questions on announcements? All right, next slide. Making sure I'm not missing questions. Nope. So Gravity's, we are a representative and sustainable consensus community that's collectively driving social care data standards to support the goals of population health and health equity. Next slide. We always make sure to center our amazing sponsors who help support this work. As an HL7 accelerator, it is a member-driven, sponsor-driven initiative. So we could not do what we do without our sponsors. We are unique in that we do have a designated sponsorship model for entities that usually would not be able to financially support the project, but are critical for its work. And these are focused on patient representatives and community-based organizations that offer direct service and direct care. And we are incredibly grateful. We have a new member that we're happy to announce today. The National Health Council is coming in as a critical synthesis of patient voices and patient advocacy. They're one of our designated members and just incredibly grateful for them. They are the source of and reference for every single patient-driven initiative I've done across my clinical work or Gravity. So to have them at the table is really wonderful. Next slide. 2025 roadmap has not changed. So pretty soon we'll get our 2026 roadmap up for you to see. It might be like another month or so. And then we continue to work on our enhancements in Gravity. The program classification edits after the vote are almost done. We just have some final consensus comments to resolve there. The technical workstream carries on in the technical meetings, and the implementation affinity group, as noted, is quarterly. And again, looking forward to this fall work together that we just kicked off. Next slide. We always make sure that we ground in our principles. We did hear one of our members at the last call highlight that these may need to be revisited and refined. We're always open to doing that. And so we're going to try to have our members lead that conversation in the governance committees and then figure out a path forward there. But those 6 principles that we crafted together in community, again, 6 years ago, are improving personal health outcomes, improving population health equity, ensuring personal control, designing appropriate solutions, ensuring accountability, and preventing, reducing, and remediating harm. I really encourage folks to do a read of the whole set of the principles because there are lots of concepts that are called in this document that aren't explicit on the slide, like topics and consent and autonomy and bias. And so there's lots of depth in there. So encouraged to download the principles and read them so that we can, we're going to work with members and see if we can find space and a method to update them. Next slide. I think we're good on the Gravity overview, and I think we're going to go into the content now. Next slide. Next slide. So we just wanted we're kind of trimming our intro stuff, right? Because we're beyond the kickoff now. We're really getting into the work. The theme you're going to see across the slides is we did the kickoff, discussed all of these broad themes early over the last couple meetings. Oh, you can go into this slide. It's okay. Amazing, the amazing friends I have. But now from henceforward, we're going to actually be really trying to just highlight things on the slides that are actually being, have been gone through the SME process and subject matter experts has identified as being critical, right? So there were lots of broad themes discussed in the kickoff and broad themes discussed last meeting as well. So we're really focusing in on the specific things that SMEs have identified that matter, but this is the theme in general. So we are focusing on community concept level concepts, knowing that the role of community health in facilitating sustainable health outcomes is long established. We brought in our old friend, the World Health Organization Conceptual Framework for Action on the Social Determinants of Health. It was Gravity's founding conceptual model and remains kind of an ethical model for the work that we do. It very clearly states how structural forces and socioeconomic and political contexts and structural determinants trickle down into social determinants of health. And the only way to affect them is through implementing policy changes and socioeconomic and political context level interventions. This is important because many of the community domains that we have at hand today do require policy interventions to address them. I always make sure to highlight, even though it's very tiny, the small little box in the bottom right that says health system, which identifies that the health access to the health system and the role of healthcare professionals within this model is critical and called in because we have a moral, like an ethical objective, they say, to work on these things to improve outcomes. And we've just been planning these community domains since 2019, and it's just our honor to finally do this work. Next slide. We just did also want to note, this is a theme for anyone who's been with us for some time. So we are very careful always to think about the origin of data, right? So we have unique data sources for these domains. So usually our primary data elements that need to be confirmed before they get put on patient records arrive through surveys and instruments, right? A patient might identify in an instrument that they're food insecure, and you talk with them and they actually confirm that they're not, and so you have to verify it. We have a whole paper we did with AHIMA and colleagues and other members and member colleagues on the role of verifying, the role of verification in transmitting questionnaires into confirmed findings. You can find that in our resources. In this community level domains, we actually have data that originates not in instruments because it's community level data through the Center for Disease Control and Prevention or HUD or the USDA, right? And so we just know that that's different than we had before, right? The community that a person lives in, we know things about that community that did not arise from surveys. We acknowledge as we're doing this work that all of those concepts that arrive at the community level have to be evaluated with concerns for the source of the data and equity in mind, right? So we know from the works of Ruha Benjamin, Safia Noble, Meredith Broussard, and Joy Buolamwini that algorithms and data, the design of available data elements, carry the bias of the designer. So some of the elements that come up, such as especially when it comes into neighborhood safety, we just are analyzing to see whether they're actually aligned with and evaluated with bias in mind so that we're not perpetuating systemic and structural harms in our identification of data elements. We've talked about this 2 weeks ago. They're just like nailing it down again here. But again, this very much aligns with our data principles, which we encourage you all to read again. But just know this is the approach that we're taking, right? Like, where are we aiming? What are the goals? And what are the data sources that are going to help us get to that goal? This again ties back to the Gravity vision, which was just confirmed and restated in the spring. Next slide. Okay, now we're getting into the meat. This is where we are. We are midway through our threshing mode. I'm sorry, I have a former farmer, right? Trying to pull up and pull in all of the data elements that matter. So the instruments that matter, the questionnaire methods that matter, the data sources that matter, the diagnoses that matter, and the interventions that matter. You're going to see us pivot over the course of the next weeks from pure instruments to initial diagnoses and diagnostic concepts. And then we do this process really for the course all the way through September and then in early October. And then we start to do this refinement and end-to-end review. So we're right on target. It's early September and we are in the threshing mode. So please do send any data elements you think that we need to review to Gravity Project at HL7.org, and it'll be part of the process. Next slide. Any questions on Sarah's rapid fire? I'm trying to make sure I'm not missing anything. No, we're doing good. Okay, feel free to ask questions. Most of the people I see here, we know very well, but it's a come one, come all and a very open environment, even if we have we follow scientific methods and processes. So please let us know if you have questions. Next slide. And next slide. I believe I'm passing this off to my dear friend. Is this where am I doing this part and you're doing?
You do this part, yeah.
Okay, sorry, my apologies. It's Asha and I are sharing. It's like the talking stick goes, from preschool goes back and forth throughout. We're switching from level setting into talking about emerging concepts because that's where we are right now with our work, really. So neighborhood safety, we know it's a foundation for health and well-being. All of those amazing papers and links that we sent out for a while about learning background approaches from the Urban Institute or the CDC about all of the domains, they're still out there on the Confluence if you want to find them. But where we sit right now, really guided by our subject matter experts, because they are driving everything that's happening that's coming to you at this point. It's really important to note that neighborhood safety is multifactorial. It's more than just the absence of crime. We've talked about all kinds of intersecting forces, and you'll hear us talk about those as we go on that contribute to perceptions of safety. And as noted and partly related to the World Health Organization conceptual framework, it is fundamentally a community level condition that's shaped by structural forces, right? We've talked about this before. This is a very common theme within Gravity, but it's important to level set that here. Our emerging concepts that we're leaning into, the first two very clear concepts that we have relate to work that's happening across the country to develop consensus metrics that cities can actually act on to improve perceptions of safety and community safety. And this relates to what we said regarding data and bias. Like, what data is going to help cities and communities and neighborhoods actually move the dial? The first two that were identified in this consensus work that Gravity's pulling in through our subject matter experts are conceptions and perspectives in perceived safety. And you'll see our questions that the subject matter experts are identifying, pull in this and all these elements of that go into that, how safe people feel walking outside, letting children play, or interacting with neighbors, right? There's all kinds of questions you're going to see emerging from that. And another critical one that's related to the work that we did, of course, within incarceration a year ago is trust in law enforcement, right? So it's not just trust in the neighborhood, it's trust as an entity in interacting with law enforcement and like living and working and existing within a community. There are additional elements that we're pulling forward as well. We don't have we have a lot of conversation we have to do with subject matter experts before we bring them to you, but these are the top two that are coming out of our subject matter expert driven initiative at this point. Hi, Lucy. Do you have a question?
Is this a time for comments on these bullets of emerging concepts, or you want to wait a minute?
I would offer those concepts now. And again, so these concepts come from
I know.
expert work that precedes us. So yes.
Okay, but one purpose of these meetings is to comment on expert work.
Oh yeah.
And
Yeah.
raise appropriate questions, right?
Yes, exactly. 100%.
Okay. The second bullet, trust in law enforcement. For some reason, I'm interpreting that as a one-way street, that the community needs to develop trust in law enforcement, when in fact, it has got to be a bilateral effort. And so I'm wondering if there's a way to phrase this particular concept that implicates, I'm going to say, both parties, law enforcement and community members.
That is a good question. In the instrument we're about to discuss, which is from the National Institute of Justice, you will see that there definitely are metrics that are aligned with just that, Lucy. Right. So I want to note that from a comprehensive strategy on community perceptions and community engagement, I'm holding that up. We will bring back to the SMEs how much we can alter this core concept because we do have to reference something, right? So, but I think you'll see in that thing that we reference may be already defined. And so we have to be careful so we can't deviate too far from that. But I hear what and I do think the National Institute of Justice initiative will help support your perspective. Yeah? Lucy?
Thank you. I just want to be sure that this is not a parallel concept to you have to change your attitude.
Oh,
There's
yeah,
always a
no.
reason. There's always a reason for why I have an attitude about something. And it's not just my pathology. It's your oppression that I'm reacting to. So, so I just wanted to register the hope that this particular bullet about law enforcement, which is extremely sensitive and so important, could be more reflective of a reality that certainly a lot of people on this call probably understand. Thank you.
Yeah, and Lucy, thank you. And I think you're also highlighting something that I think is important for how this slide differs from the slides that come after. What we did not do, and I should have probably, is expand the micro dimensions that you saw that I did with perceived safety, right? And that will come. So thanks for calling in that this is a complex concept. It is, right? And you'll see, I think, in the questions that support this concept, some of the subtleties you're speaking to. Because I didn't do colon, right? Perspectives on bias, perspectives on, just treatment perspective, but you'll see those bloom. And again, I could have done that. I get a little wary, Lucy, sometimes of trying to represent subject matter expertise, but we'll get there. And thank you. All right, next slide. I believe I'm passing.
Well,
Oh,
got
it's
one
still
more.
me. I know I'm doing it. Okay, next slide. Oh, that's right. You're like, no, Sarah, one more. Okay, thank you.
One more.
Okay, Lucy, I hope this helps answer some of your questions, right? So drawn from our work last year and our really amazing collaboration with friends at the Department of Justice, supporting the Department of Justice's work in supporting reentry waivers and refining their methods and processes, in order to kind of pull in good methods of assessing what trust in law enforcement looks like, because it was elevated again by cities as a metric that mattered. And so we had to go out and find methods that assessed for it. We found this lovely initiative from the National Institute of Justice. And it was basically a neighborhood challenge. It was a challenge to communities to assess community perceptions of law enforcement across all these different variables. And it was this beautiful initiative. You can read about it in the link that Sarah Bahal just sent through. And we presented, we found this like really because of our work last year, and then brought it to the SMEs and said, are these questions and methods that point to this concept that you identified is an important metric? So per the NIJ site, this whole initiative was kicked off because historically community perceptions of public safety utilized methods that were not representative. It overrepresented the views of affluent, educated white people because it was like community meetings, right? Not getting the folks who don't have time to come to meetings or don't feel safe coming to meetings, or couldn't participate in that method. And so they recognized that the existing methods they had for public feedback were not representative. And so they kicked off this national initiative to try to address that, to make sure that they had a method that was addressing bias, and it was representative, scientific, and standardized and reproducible, right? And they could attract, like the law enforcement entities could extract data that was actionable and community-based and local in order to affect local change. So it's called the Measuring Community Perceptions Challenge. And these are the constructs, definitions, and survey questions that NIJ uses in that. And you'll see some of the survey questions are already approved by our subject matter experts. And Asha will go into that. She's the instrument girl. I keep on forgetting. I'm concepts over here. She's taking instruments. Got it. But Lucy, part of what you're speaking to is the community policing concept, right? And the collaboration concept and concepts of respect, right?
Exactly.
And I'm so glad.
Exactly.
Yeah,
Thank you.
I'm so glad you feel like you're classically Lucy, like raising a ping, and I'm so glad you feel like this does kind of get into this comprehensive multifactorial approach. Please do read the NIJ landing page. It's really quite thoughtful. And now Asha is going to take, because we pulled as many of these concepts through as we could And Asha's going to take us through the concept the subject matter experts have already approved. Asha, finally, now take it away.
Thank you, Sarah. Good afternoon, everyone. So, as Sarah just said, these are a few of the items from the NIJ's measure of community perceptions. And we have 3 items that our SMEs move forward that we want to share with you today. The first one is about perceived safety. Is there any area near you where you live, that is within a mile, where you would be afraid to walk alone at night? And the answer concepts are binary, yes or no. And just throwing in a little bit of my lived experience, we live across the street from a park, and we love to walk that park every day with our dog, but we do not like to walk that park at night. We would not feel safe walking alone in that park. So that question is very relevant. The other 2 questions are the police are about trust in law enforcement. One, the police department holds officers accountable for wrong or inappropriate conduct in the community. And the other one is the police act based on personal prejudices and biases. And the answer concepts are the same for those. Likert scale ranging from strongly disagree to strongly agree. So this is a really good start for this domain, these standardized questions, and more to come, more to come.
And I'm
All right.
just in the pinging, I'm just going to say a couple things. How we got to the first question being a good question is a process of looking at multiple questions that were not good enough, right? So simply feeling safe walking near where you live, our SMEs said, no, because there's difference between night and day, right? And we need to find a question that can specify that it's like at night, right? And so there is a whole discernment process behind the scenes. And so this is the best question of its class that we could find so far for that perceived safety element. More will come. But again, this is the initial push. Go team.
All right.
Any questions on the neighborhood safety questions? And just as you can imagine, with our past work, right, these questions highlight dimensions. Those dimensions will eventually become concepts that are kind of findings or diagnoses, right? Like feel safe walking in community at night or something like that, right? We'll get there in time, but we're just beginning. Next slide. All right, so now we're going into food access. Does social context matter? That I'm going to say just yes, Jonathan, but there's a lot in what you said, and so it depends. Like, is it social cohesion? Because we talked about social cohesion and belonging, and as a general concept a couple weeks ago, and in our kickoff. Like, can you just come off mute and let us know what you're? Because the answer is yes.
Okay. So neighborhood safety means different things to different people, right?
Yeah.
And so like I myself, where I happen to live in the Bay Area, there's a high income, high tax bracket. But I happened to be walking down the street one day and there was another a couple, right, that happened to be people of color that looked at me like I was a threat. And I was like, I actually live around the corner. I've never seen you before. Right. So they were fearful of me, even though I was a resident of the neighborhood and I had never seen them before. Whereas somebody that is like walking, say, in Oakland, right, may feel threatened in that environment, even though the people who live in that environment might not feel threatened. So that's kind of what I wanted to know about the nuance of the social context of quote unquote safety.
Yeah, so your and Lucy's comments kind of relate. So if you can imagine this, there's general concepts in like neighborhood safety or community safety, and then there's dimensions underneath it. By saying perceived safety, it really means I feel, right? That's the I feel safe, right? So Lucy, there's still that overarching community safety and neighborhood safety concept because there's lots of different things in there, but the I feel is one of them. And then Jonathan, in I feel, there's a lot of context, right? Even just the stories we were telling, because I'm an addiction medicine specialist, I don't feel unsafe walking around my town most any day, right? Because I have all of these tools in my toolkit. I am unfazed, right? And that's not the perspective of most of my neighbors, right?
Well, and so that's when I ask about social context.
Yeah.
In terms of the end user who's using this, like theorizing what safety means in their mind, I think is going to be the most challenging part.
Yeah, but that's also why those higher level concepts and the I feels are important, because if you don't get to the feel statement, it might get muddied in the community level. Like what you just told is a story that if you didn't of how the community level data might not represent your own personal experience, right? Am I making sense?
That, right, that part, right,
Yeah,
yes. Yes, but I wanted to make sure that we were
Yes.
clear on that, right? Because
Yes.
from the social context,
Yes.
okay, perfect, thank you.
Got it. Go team. Right. Perfect. And you'll see a lot more feels questions emerge as we go forward. And they're coupled though with these large, community level concepts that might be a little bit different, right? Okay. I feel like it's like makes me think about my early childhood education work, feeling statements.
Mm.
All right. Okay. Oh yeah. So Lucy, I hope as the elements bloom, we see how they all kind of marry together to create like a comprehensive concept.
I didn't
Uh,
mean to delay anything, just know
Yeah.
that I'm alert about this.
You are
Okay,
alert. I feel you.
thank you.
All right, next slide. All right, so this is kind of an important grounding. We're just never going to neglect this. The topic of food insecurity in general can be a little confusing. In this instance, what we're doing within food access, in some instances, is described as community food security, right? We are gratefully and methodically framed in our work with community food access by what we've done before, right? So in 2019, we addressed household level food insecurity, operationally defined through the USDA. And right now we're talking about these community level concepts in food access. And in some instances, it's called community food security. We're calling it concepts in food access to differentiate and to follow the line of the USDA in most of its materials. In some of its materials, it still uses community food security. So it's a little bit confusing, but there we go. Next slide. What we want to note, you're going to see instruments that that the SMEs, again, we're narrowing on things the subject matter experts have agreed on, right? And you're going to see that on the slide. So we talked about high level concepts before. We're narrowing in here. We didn't want to do that before we highlighted what the SMEs are rumbling on, right? Like literally discussing, needing, noodling on. They're discussing how to clearly arrive at concepts regarding quality, because many questions ask about, is the blank of high quality? Is the produce of high quality, right? But yet our subject matter experts are trying to figure out if that question is good enough, right? Because just for context, we have to use the word fresh, or we've been so far using the word fresh as aligned with the USDA, which differentiates fresh vegetables from frozen vegetables and canned vegetables. Because again, we're following the USDA method, so we can't use fresh twice, right? So what does high quality mean, and what instruments can possibly get to it is something we're leaning into. We want to note that there's also considerations of this for rural transportation. One of our amazing food sovereignty and food access experts, Cheyenne Robinson, was talking about the quality of the vegetables at the end of the trucking line as they're shipped from Idaho to her location where she lives in Montana. They're not in great quality by that time. And she was leaning into concepts and quality that talked about free from bruises and spoilage and damage. And we haven't found instruments that really do that well yet. And so we're working on that. SMEs are also discussing how to clearly arrive. Yes, variety. That is easier. Tyson, thank you. Welcome. We appreciate you. Selection is an easier available. You'll see we should have put we didn't put the A's down there yet. We'll do that next time. So we want to note that selection is a critical concept we're talking about as well. You'll actually see some questions on selection and variety in the instruments they've approved so far. SMEs are also discussing how to clearly arrive at concepts of what healthy food means beyond just produce, right? This includes talking about discussions on low fat and what this means to patients and people, and whether asking about the presence of low fat items is sufficient. So this is where we are with our subject matter experts at this time. And of course, they're also continuing to investigate concepts in cultural appropriateness, recognizing vegetables and concepts in food sovereignty. Again, I recognize or did not recognize, you'll see some of those concepts in the instruments that we have today. We're just trying to find additional instruments because there's a really good example of an instrument that does this for produce only. And we're trying to find other instruments that do it across the necessary food types. Lucy.
I am not acquainted with the phrase food sovereignty. What does that
Oh,
mean?
love it. Okay, so food sovereignty is a concept. Food sovereignty is a concept that's very specifically leveraged within the indigenous community to talk not just about like the food is appropriate, but it's also recognized as authored, created, purchased, engendered by the tribal community of reference. Right? There's USDA has a lot of materials on food sovereignty that I can drop in the chat for you. We were connected to Cheyenne, who's actually a food sovereignty and food access consultant through our friends at the National Indian Health Board. But we didn't want to be remiss in addressing this within our focus to make sure that we are representative in our work. There's a lovely, again, we'll try to put the brief on food sovereignty. I think we might even have it on the Confluence already, but I'll put it in the chat once Asha starts talking. Next slide. All right, so Asha's going to start talking about instruments. Next slide. And so I'm going to find this food sovereignty link and put it in the chat. Asha, carry on.
Perfect, perfect. Okay, so we have four food access screeners to share with you all today. And the first one, it comes from MEPS, the Medical Expenditure Panel Survey from the Social and Health Experiences. And this is question 3C. How would you rate the following characteristics of your neighborhood: availability of places to buy food? And it is a 5-point Likert, and the answers ranging from excellent to poor. And what this gives us is a person-reported measure of neighborhood food access, specifically perceived availability of healthy food options. And it really does complement household food insecurity screens by capturing the local environment, not just the household hardship. Okay, so that's screener number one. Moving on to the next one. This one comes from the neighborhood scale, availability of healthy foods. And this question is: a large selection of fresh fruits and vegetables is available in my neighborhood. And this also gives the answers are answer concepts is a Likert scale from strongly agree to strongly disagree. And this captures the perceived availability and acceptability in the local food environment. So it really kind of unearths another dimension of food access. And then moving on to this tool. This is a lovely tool from CalFresh. It is the Fruit and Vegetable Community Assessment Tool. And this instrument was designed to capture multiple dimensions of food access, specifically to fruits and vegetables, not just whether the food is present, but whether it's affordable, high quality, and culturally appropriate, as Sarah said earlier. And so in the first section, you'll see here the questions it asks: where are you buying your food? Is it from a grocery store, a farmer's market, a flea market or swamp meet, or the convenience store? And then the answer concepts are really nice because it's more than just yes or no. There is a yes, but, right? And the but will really elucidates more dimensions of food access. Is it too expensive? Is it poor quality? Is there not a good selection? Getting to the variety that Brian talked about earlier. Does that store accept EBT and WIC? Can you get there within walking distance? If not, is there public transportation to it? And other problems or concerns. So it really lifts up the barriers that exist to food access for those four different food store options. And then there's a rating scale there at the bottom. If your community has fruit and vegetable resources, use the following rating scale to evaluate the overall condition, getting again to the acceptability of that produce from awful to excellent. So this is a really, really good tool, and there are a few more. It's a long tool, so there are a few more things to share with you on that. So question 5 asks, is there a community garden where you can grow your own fruits and vegetables? And here again, the answer concepts I love because it's a yes, no, and a yes, but. You might have some access, but not quite all the full access. And some of the barriers it lifts up are there convenient hours? Are there is there a available space? Is there litter? Is the soil contaminated like it is in my neighborhood? We cannot grow food directly in the ground. We have to use raised beds because the soil is contaminated. Is the garden not in a safe area? Is it within walking distance? Is there public transportation? So this question really does pull out a lot of details related to all of the dimensions of food access. And then the next question is about food banks in the community. Again, it has that same answer concept, lifting up the barriers that might exist, the convenient hours, adequate fruits and vegetables, the quality, is it safe? Is it accessible in a walking distance from your home, or is there public transportation? And then there is one last question, number 7. Are the restaurants in your community that have fruit and vegetable on the options on their menu? And why this is significant is because in some communities, there are only restaurants available to purchase food from. So it's important to understand the quality or the level of access to fruit and vegetables on that menu. So again, the answer concepts, yes, no, but a yes, but, with other barriers lifted up. And so again, you know, the addition of the restaurant is important because it includes that in the food environment. And it is a common source of food for some people in the environment that they live in. And then moving on to the last tool, this comes from the Perceived Nutrition Environment, the NEMS-P survey. It's designed to capture where people are actually buying their food and how accessible those options are. So question 7 asks about the type of store where you buy most of your food, and the options are there: supermarket, grocery store, corner store, super center like Walmart. So it's good to understand where people are buying their food. And then question 8 is thinking about the store where you buy most of your food. How do you usually travel there? And this is the intersection, right, between food access and transportation and security. As I said 2 weeks ago, in my community, 40% of my neighbors are transportation insecure, and we live in a food desert. So it really is important to understand how people are transporting or traveling to get their food. And then finally, question 13 is, where do you usually purchase fruits and vegetables? Supermarket, grocery store, corner store. So, you know, together, the NEMS-P items help us understand what's not just what's nearby, but what people are relying on and how they travel there, and whether the produce is a part of their shopping routine. The last answer question on here is, I don't buy fruits and vegetables. And I think that's important to know too, that people aren't buying fruits and vegetables. So these are the screeners that our SMEs have identified as valid for being in the value set. And I'll pause there.
I see Lucy's question.
Okay.
I was a
I
whirlwind,
love,
but I'm gonna, so Lucy, you go first, and then I'll try to get to the questions in the chat later. You go
okay,
first.
I love this bullet. I don't buy fresh fruit and vegetables. How about another bullet? I don't eat.
Oh,
Mm.
yeah. Yeah, yeah.
Joke, Sarah.
Oh, I
Joke.
know. I know.
Okay.
I feel you. I feel you.
I know. I hear you. Yes, I hear you, dear Lucy. Okay, there's a whole, and the only reason why Lucy is such a long-standing Gravity person, she has perspective on everything we've ever done. So she can make jokes that she and I get. Oh, so good. I want to there's a lot of questions in the chat. I just kind of want to run through them. So Corey, my lovely partner in the good, the Kenny Rogers to my Dolly Parton. Do you want to come off? You're asking for technical reasons. Do you want to come off mute and ask publicly? Or are you feeling comfortable?
Yeah, sure.
Okay.
Yeah, I think hi everyone. Yeah, I think, as we look at these and we think about, what we're making observations about, are we making observations about a person or about the community that they live in? And that matters because the solutions we model in fire will have to reflect that. So that's my question is, are these person level concepts or are they community level concepts? And I think the answer, Sarah, was that these are assertions about the community, but stated through the person's by an individual.
So far, the questionnaires are, right?
Yeah.
But the other data sources are not. Like the USDA
Mhm.
access data, that is not a person level, that's a community finding, right?
Mhm.
That is
Mhm.
it's like a statement on the community. So we're gonna have both.
Yep. Okay. Thank you.
Okay, so did what happened just happen? So Corey's the technical director of Gravity, a very dear friend, and he was asking, I just wanted to call them in. And then Rob, dear friend, Loink genius, general terminology genius, asking questions about data usability. I just want to note in this instance, this is such a good instrument. We had to bring it to you. The entity that authored it is no longer existing. It's a California instrument and it's a government sponsored one. So we think that we can find it anyway. And it was funded by the USDA. But we couldn't not bring it because so many of the concepts the SMEs were circling around were answered by it. In some instances with instruments that are, we have access to, we're able to slightly tweak the method in the build to support better data granularity and data clarity. Maybe we can do that in this instance, but Rob, just want to note what you're saying. Yes, but it's a little complicated. But it was a USDA funded instrument. So I'm hoping we can.
Well, are you suggesting that it's in use? Is that what you're
Oh, it is in
suggesting?
use. Yeah. I mean, it's right on the, CalAIM, the
No,
Cal.
I get it's available, but
Yeah.
if you're suggesting that that what you get from your SMEs is that there's data that's being already collected and it's regularly in use, it's still going to be a mess.
I
in my
hear you.
opinion.
Yeah,
But that's one thing that we'll have to consider in terms of our adoption of it.
but one thing that we did, Rob, and we've done this before, is we think about how we've used cascading logic and additional questions to sometimes clarify things. Like we did that. Sorry, off track. I can talk about this with you about.
Yeah, we can
Yeah.
deal with it later. I just was noting that I didn't like it.
I hear you.
And it would
But-
be, and I'll have some issues when we make concepts to
Yes.
represent those things.
And sometimes issues with data clarity and questions can be solved by adding additional questions. We did that with the housing stability vital sign, where the last question conflated history of homelessness and imminent homelessness, right? And so what we did is worked with the developers to actually not disrupt the data that was being collected, but get to greater data clarity through question additions. Who knows? We've done so many different kinds of things.
Yeah.
Maybe, yeah.
So, but I'll just close by saying it'll just be really useful to get a sense of how many organizations are utilizing those instruments to date right now. Because obviously going in, we would want to then represent it as it is and just deal with the data as it comes out.
Exactly.
As opposed to, well, this is kind of a fresh slate. We can make some tweaks to it. Then everybody that uses that in the future will have to use our version.
Yeah. I'm a little worried that if the government of California is saying use
Yeah,
the instrument, we're kind of down a path.
I think we're stuck probably. Okay, thanks.
I also saw a question regarding the use of nutritious and nutrient dense. Just saying, hi, lovely question. Thank you so much. Nutritious and nutrient dense are things that we talk about often given our close relationship with the American Academy of Nutrition and Dietetics and longstanding relationship with RDNs. Go registered dietitians. Those concepts are usually more granular than relate to the concepts in food access, but we'll bring it back to the SMEs. It's usually those concepts relate to when we start to talking about household purchases, right? Like what's actually brought into the household, but there aren't a ton of concepts in community food access that drill down to that level. But I will bring it back to the SMEs. And I think that was it. LJ is not tiresome. LJ is lovely. Okay. Oh yes, and Carol, we had lovely conversations regarding concepts like that within our food insecurity work. So thank you for bringing that up. Okay. I think we're there. Yeah?
I think so.
Thank you, Tyson. Bye. Okay. All right. I think, next slide. We had the data. I don't know, Asha. I think this is you too. It's me. Okay. So I'm getting lost. Eventually, it's okay. Luckily, it's just Asha and I, and she's just telling me what I'm supposed to do. So, Corey, this relates to what we were talking about a few minutes ago. Not all assessments are at the person level because this concept is solidly community level, right? This is by census tract, right? So one of our core fundamental concepts that is grounding our work, and we met with Elena Rowan, the brilliant wizard of the Food Access Research Atlas and the Food Environment Atlas from the USDA, and she's trying to see if she can become a formal part of our work or just contribute asynchronously. But Ash and I had the honor to meet with her last week. Brilliant, humble, wise, just gorgeous mind. It was just a great time. So the USDA has in existence this Food Access Research Atlas that has determined low access variables for census tracts for a long, long time. And so this would be an assessment of the census tract. It would not be a person level assessment. And it would be, you could actually easily have conversations about the dissonance between person level assessments and community level findings here. You saw this last week. Next slide. All right, access to green space. Next slide. So this is a lot simpler than the slide we had before. Because again, we're focusing and narrowing on concepts. Are we okay with food access? We didn't have a question break. I'm assuming we are because you all put questions in chat. Okay. We're gonna. Oh, hi, Julian. Sometimes I fight the temptation. Oh, hi, Julie. Okay, he's putting in the anyway, Julian's a dear friend, one of our subject matter experts. Nice to see you here, friend. What we've narrowed with access to green space are the dimensions and variables we're circling on around right now that have been approved by our subject matter experts. This is a lot more focused than the slides we've presented in the past. You'll see this theme throughout our work, right? So when we are talking about access to green space, there are these core concepts that we're drilling down on, concepts of availability, accessibility, acceptability, utilization, and safety. On the safety element, you can see how closely this relates to neighborhood safety and why we're doing these two domains together by design. So on availability, you'll see, and again, what we're trying to do is pull forward things that show and align with concepts that SMEs have already said are okay and relate to the instruments you're about to see. Right, so very, or data sources, Corey, right? Because the CDC instrument, for example, or ParkServe are community level findings. They're not person level, right? So, and we're pulling in here differences between urban and inclusive concepts because many of the statements on green space relate specifically to experiences of living in urban environments, but we can't neglect to consider those who do not live in urban environments. So we're trying to find instruments that detail that as well. Very clearly, we have urban availability, access to parks. We have in parentheses size because it's hard to determine whether size is an availability because for the WHO, it very clearly is. Like it only matters if it's of X size or it's an acceptability quality element, but that's there. Yes, Lucy?
When we talk about green space, it is implicit that we are talking about public green space. Is that correct? Otherwise, I could say, well, I have a garden. Is that green space?
Well, yeah, so we have been framing in public access. Actually, the UK instrument that Asha is going to present shortly, that I'll give my little mini story on because I love it so much, does exclude gardens from the analysis because it's trying to talk about community level experiences.
Okay.
There are
Thank
some SME thoughts on that because and I just literally I spend hours of my life in my garden in reverie because I live in a wild ecosystem that I make, but it's not part of the domain so far as it's been shaped. But related though, the inclusive availability, as we are trying to not be bound just by parks, right? Because in rural environments, it's not always a park. It could be you can walk in your neighbor's meadow, right? In UK, you have access to all kinds of private spaces through public rights access. And also just making sure that non-identified park spaces that are publicly available, like, non-identified beaches or spaces that are not designated, I think about all the places kids roam in cities that are wild and undeveloped. At least when I was growing up, we're trying to make sure that we identify those spaces as well. And so that's why we have this inclusive element. In accessibility, we are talking very carefully about being able to walk to it and what that means and how far is the base measure of that is close enough. Accessible infrastructure, you'll see a lot of that come into play as well. And then we're also talking about acceptability, park quality. We're getting to and will consider concepts in utilization and safety in time. But specifically, you'll see access to parks, access to all kinds of public nature spaces. And you can see we're talking about nature and not just green space. Walkability and accessibility and park quality are blooming, no pun intended, in the instruments to come. All right. Asha, next slide.
Yes,
Take it
all
away.
right. So we have two good instruments that the SMEs moved forward. And the first one is the MEPS from the Social and Health Experiences, question 3B. How would you rate the following characteristic of your neighborhood: availability of parks and playgrounds? And you see the answer concepts, another 5-point Likert scale. This is a good, solid perception-based measure. It doesn't capture actual number of parks, but it does capture at the person level their perception of parks and playgrounds and the ability to play and use recreational spaces. Solid question. And then the next one is, Sarah previewed it already. It is the Adults, People, and Nature Survey for England. Very, very lovely. Question 5 is the question that we really wanted to highlight because this survey really does ask questions and ask the people to reflect on their local and green and natural spaces and whether they agree with a series of statements. And here they are. My local green and natural space are within easy walking distance, a good place for mental health and well-being, a high enough standard to want to spend time in, a good place for children to play, places that encourage physical health and exercise, good places to meet other people, and provide good opportunities to see nature. So what you see here is that this question really cuts across all of those dimensions that Sarah just talked about. And of course, the answer concept is there with strongly agree all the way to strongly disagree, with a don't know and a prefer not to say as well. And this really makes the survey particularly rich for capturing not only perceptions of access, but also the quality, usability, and social value of green space. So the SMEs really did like this question. And then Sarah, I'll turn it over to you to tell your story about this.
So who's tiresome now, Lucy? I am. Because one of the things I love, and it's actually in the instrument, if you look at it, is how they defined green and natural spaces. because I hadn't found an instrument, we hadn't found an instrument yet that, and this is like, Jonathan, if you're still here, talk about like perceptions that centered just natural spaces as opposed to parks, right? And natural spaces being inclusive of blue spaces. Like my primary, and anyone who knows me knows this, my primary feeding myself and connecting to nature experiences are in lakes and seas. My family lives on the coast of Maine. I go to rivers. I literally pay homage to this massive lake I live next to, one of the Lake Champlain, 5 times a week. I walk there, I sit there in the morning before I start my day. So the thing I loved about this question too, is it's inclusive of blue spaces that matter too, and undeveloped nature spaces that matter in its definition. Sorry, there's some background noise. But that was really important to me. And so that's partly why this instrument is so beneficial. And I think really helpful. It was hard to find. There's really not, we've had to go to England to find it because there really wasn't, as we have looked so far, there really isn't a good brief correlate in the US instruments that we've found to date. 3 tiers for blue spaces. All right, next slide. And next slide. I think we're on to the data sources. Is this me again?
Mhm.
Okay, here we go. So Corey, again, this is a community level finding, not a person level finding, right? So we're gonna have both, right? So we have a couple sources of data describing community level experiences that we are going to detail. We brought them to you a couple weeks ago. We have another one we're investigating, but we're going deep and nerdy into the methods for this one. So we'll see whether it makes the cut. I went through these 2 weeks ago, but really it's important to look at the operational definitions because they're different, right? So the Trust for Public Land ParkServe talks about this 10-minute walk analysis and has a park inclusion criteria, located outdoors, named destination. So therefore it leaves out the beach that I go to every day that is not named and it is not on any map. It has to encourage informal use and it has to encourage at least one park-like activity. You can always find the technical details there. So this is ParkServe. Next slide. And you can see, so we have that availability and accessibility, right? Accessibility is that walkability, availability is does it exist? It'll be interesting to model. Yes, sir. So Susan's a terminologist and a fire girl. Yeah. So this is the ParkServe. We talked about this a couple weeks ago with the view of Atlanta. Next slide. We're not going to go into it again, but it's important to leave it there. So this is another publicly available data source that differs slightly. And this is why it's important. So when we start to think about the data that matters, the operational definitions between the ParkServe information and the CDC is slightly different. And so when we're thinking about definitions, we're literally like trying to focus on one that matters, right? So this is the CDC National Environmental Public Health Tracking Network. The operational definition is that living within a 1/2 or 1 mile radius of publicly accessible park. This is a census tract level designation. And again, this would give you data at the census tract level that would be a census tract finding. So just, kind of like, we were talking about this a couple weeks ago, and maybe even in the kickoff, I think, you think about like what you are measuring. There's the person level measurement. And these are the things that come up with gravity. There's person level measurement. There is household level measurement. Because you were asking Corey, like, what does community mean, right? There's neighborhood level concepts that are defined in city maps, like this is my neighborhood, right? There's walkability. There's census tracts, there's counties, right? So we're going to have to be very careful in our methods, in our terms, to really clearly delineate what is the entity being measured in this data source if we're going to lean into them and use them, right? We can't mix concepts. Next slide. This is the CDC, this is the National Environmental Public Health Tracking Network for Vermont and Georgia, just side by side for different examples. And you can see in Vermont, that dark blue is the Green Mountain National Forest. Just the spine of my little state. Next slide. All right. So now that is the end of our domain updates. You will see certainly more instruments and the next time we come back in 2 weeks, and you'll also see likely some primary domain level findings coming up, Corey, both on the community level and on, or I should say, not just the community level as defined as the census tract or as defined by the county, right? We're going to have to be very clear there. And then at the person level, we also now want to go into a cross-domain update centering our dear friend, Susan Matney, senior terminologist, Loink Wizardress. Susan, come and talk
Hey,
old Loink
hi
data.
everybody. I just next slide, Asha. I'm Susan Matney. My camera's not working. If I try to, my next step in troubleshooting it, you can see it just goes black, is rebooting, and I wasn't ready to do that. But we need to align some with US Corp with Gravity, and we needed to have some document types to be used in the observation profile. The document types are like, a history and physical or a letter or a note. And we didn't have anything for gravity-based type of document types that could be used. And so we defined the document types. I'm going to show you that in the next slide. And to reflect social care roles, go back one. And just of note, Rob McClure, the documents are structured in an ontology. We didn't put the slide in here showing how they're structured ontologically, which is interesting. I would have put it there. And Rob chairs the committee, and I want to thank him because usually Loink codes take 4 to 6 months to get, and we got this probably within 6 weeks from when we put it into this release. So thank you so much if you had any influence on getting this through to get in our document type. So go to the next slide. So we have two documents. We have a social care note, and it is we defined a subject matter domain. The document ontology has a subject matter domain. It has a role. It has a location. There's different axes that are used to define the ontology, and we defined a social care note for this domain of social care. And then we added a new role also as community health worker. Now, these notes can be used in observation in FHIR, but they can also be used in CDA. So if you have a PDF that you have a structured document that is a social care note that you want to send between settings, this is the codes that you should start using within your institutions when you put a social care note or a community health worker note in your system. So we're excited that we finally have our own documents that we can share. So please use these codes for your documents that you have in your systems. Thank you. That's it for me. Hey, Rob, did you want to say anything? Are you still there?
No, I'm here, but I have nothing to add.
Okay. But I want thank you so much, Susan. Thank you for your I think it's like you arrived to Gravity at the right time, right when we needed you to
Thank you.
help spearhead this work. And I just want to note that it was a year in socializing the concepts and the notes with other entities, including, here in the public hall, we went out to different HL7 work groups, to the Human and Social Services work group. We really tried to make sure that those entities that in the standards community that would be possibly affected by this were included in the process. And it's true, I did not represent the ontology. I should have probably, it was very pretty, Susan, your beautiful representation, but we did want to make sure that we included the little semantic, the defined domain, the semantic domain of social care, which is part of how you get social care note, because you take note, which is defined, and you add it to the new social care domain that is defined, and you get social care note. Right. This is what we've done so far. If you go to the next slide, I didn't put this on Susan. There's a whole lot of other concepts that we might define in time, right? We do know that there's settings, right, that are, out there, the community-based organization setting we use extensively in our implementation guide, and we talk about it in our models. So we haven't leaned into that insofar as document types go yet. We want to acknowledge that there might be different types of services, right? So another part of the ontology are types of service definitions. You know, it might be that we started with these two concepts, community health worker note and social care note. In time, there might be different settings, different types of service, and different kinds of documents as we enrich the LOINC document ontology and LOINC document codes. Lucy?
And if you need them, let us know,
You
because we
need a
want
list? I
to
know.
know. Yeah,
Yeah,
we want to get them.
That's our job. Lucy?
Yeah, I'm sure many people on this call are aware that organizations out there in health information technology land are very anxious to involve all sorts of settings within the concept of a health setting. So skilled nursing, assisted living, those are the two that stand out for me right now. So when we talk about setting in the future, let's be sure that we recognize that hospital stuff is only a slice.
Mm-hmm.
Skilled nursing and increasingly assisted living, where you buy in and then if something goes wrong, you remain in that facility, but you move to a different building for different kinds of, for a scope of care that you didn't need when you came in. All that is going on apace. So
Mhm.
eventually.
Yeah, and there's
Okay.
lots and lots of documents for those, but not for social care.
Exactly. So that
Yeah, and
needs to
so
get
that's
in
what
there.
we need to determine is where do we go next that's going to be the biggest bang for our buck.
Thank you.
And Corey's asking a good question about human services. So social care as defined by the NASM paper, which was vetted, is inclusive of both human services and social services. So that's the way it's framed right now. But I do want to note in settings, there's a lot more that is not here. You can imagine like housing agency, public housing agency, food bank, right? Like there's WIC agency, right? So there, you know, or like all the things that fall under human services and social services at the highest level. There's a lot that I even just think about like where the patients and people I take care of in rural healthcare go that they want to communicate back to me. There's a lot of settings certainly that are not developed here. So, well, we really want to be methodical. Again, luckily we have Susan on our team, and luckily we have our longstanding and really fruitful collaboration with Registry and LOINC. So looking forward to enriching all of the different concepts, both the general domain of social care is kind of set, right? But we can imagine new roles, new settings, new types of services, and new kinds of documents over time, like risk assessments. I just like I think about like because from one of the things our social care friends said within the social care voice co-design work is the criticality of acuity assessments as part of triaging, especially in low resource areas. Like every single housing agency has to, according to HUD, do an acuity assessment via the social vulnerability matrix before they connect somebody to services, because only the people with the highest vulnerability score go to the top of the line, right? So there's concepts like that in healthcare, but my guess is when we start to dig deep, we have just two to align with US Core to get us out of the gate. My guess is when we start to dig deep, we're going to find lots more different, at least settings, roles, types of services, and kinds of documents in time.
The other one we're discussing right now and investigating is care plans.
Yes. Yeah.
Do we need document types for care plans?
Yeah. For different. Yeah.
Yeah.
Got it. Yes. Oh, settings. Oh, yeah. So this EG is not a good EG. I should have put some of the more actually, I think I just pulled this directly from like, but to add, you know, fruit to the minds of people like Lucy. If you ever want to explore the document ontology, it's really quite fun. And so the
Right.
links,
Yeah. Susan can give you a tour.
Susan can give you a tour, Rob.
Yeah, so just you know, as a kind of, I should, just as a tamper to that. You know, one of the things that not just Loink, but everybody needs to always kind of consider, and we're working hard to try and address in Loink, is what we call kind of combinatorial explosion.
Yes,
And
exactly.
so the idea of the setting being something that's explicitly included into a particular Loink code. I mean, we do it, obviously, it is a component of the document ontology, and we definitely support it. And when we don't, when we have documents already, and there are specific settings that are important in the context of those documents, we will, you know, we certainly consider, and we'll add. If somebody really says, I absolutely need to have this Loink code for this particular reason, we almost always add it. But I just want to call out that as we think about other settings that are implicated in the context of doing good gravity work, we need to make sure that we think about the context of the overall information message, you know, that's being exchanged. And setting is a pretty common piece of data to be included in that in that message. And so
Mhm.
also sticking it into the Loink code is something that we want to be really cautious about doing. And
Makes
with that, I'll not say anymore.
I hear you there. Luckily, we have an editorial board. Luckily, there's people. And yeah, and we didn't mean to say that there would be an explosion, but suffice to say, for 2 for now. Congratulations, go team.
Yay.
And certainly within setting is, you know, that makes sense that that'd be one of those ones that we want to be frugal about.
And
But
that's a really good point because it's somewhere else in this, you know, you're getting it with, so yeah, it's, a really good point.
That is a very good point. Love it. Okay, I think we're good now. I think we're ready to go to the, any other questions? Anyway, bravo. And actually I want to note the person who said that we should just make the notes already was Rob. Rob, you have your relation.
Yeah, guilty, but still.
I'm gonna note the through line. I think it was like a year ago that we met with you and it started this little journey and then here we are. All right, so community homework and next steps carrying us home. Next slide. Catch up on materials. Again, we cited a lot of materials online. And then Lucy, I put the food sovereignty link in the chat there. So that might have gotten lost in all the comments, but it's in there, the USDA's food sovereignty paper. Read up on materials and resources, submit concepts. We want to see them, you know, research and look at the confluence, and we'll continue meeting with SMEs weekly, and we will see you again in 2 weeks. And we look forward to it. Can't wait. Thank you so much, Anasha and Susan and Sarah and
Thank you,
everybody.
Sarah. And
Bye.
Asha,
Thank
everybody
you.
who contributed. Great meeting.
Bye, friends.
Thank you. Take care, y'all.
Bye.